Being breathless is disgusting. It's the worst feeling you can have in your life. It takes ages to have a shower or a bath. It's just because of the way my breathing is. I just don't have a choice. I do what I can do, and that's all I can do. But it is still the worst feeling you can have in your life. I can honestly say that.
Chronic or persistent breathlessness is a frightening and disabling symptom. Although it cannot be cured, there is still a lot of things we can do to support people to manage their breathlessness. The Breathing, Thinking, Functioning clinical model shows how different approaches can be integrated to address unhelpful breathing patterns, emotional and cognitive drivers, and the vicious cycle of deconditioning and social isolation, which are all features of this disabling symptom. There is high level of evidence for a range of non-pharmacological strategies, including breathing techniques, pacing and positioning, anxiety management, and physical activity. But the most simple and effective thing that we can do is offer patients a handheld fan. So you get the patient to turn the fan on and incorporate breathing techniques at the same time. So you want them to move the fan across the bottom half of their face so they get the airflow, and then they can incorporate breathing techniques such as breathing around the rectangle or concentrating on the out-breath. So they'll be going This will enable them to catch their breath quicker and control their breathlessness in a more rapid way.
Recovering from breathlessness is what the fan helps you do. It makes you relax and get your breathing back into line, and that's the most important thing.
Research about the fan is still ongoing, but what we think about the mechanism is that there are at least 3 ways in which the fan helps people with breathlessness. The first is that the fan stimulates the trigeminal nerve, particularly the 2nd and 3rd division, and then that signals the brain to say you're getting more airflow, more ventilation than you really are. The second is that the fan seems to increase expiratory time, and this then reduces dynamic hyperinflation. By reducing dynamic hyperinflation, it delays patients getting to the point where they can't take in enough tidal volume to meet their requirements when they're exercising. And this seems to be a very powerful mechanism for a lot of patients. Reducing dynamic hyperinflation allows people to exercise longer and to exercise more, thereby building their muscle mass, which helps to reduce breathlessness again by a different mechanism in the long period of time.
If I have a really bad attack, I have to use the ventilator and the fan, but normally I can get over it with the fan, which is, for me, which is good.
The third mechanism by which the fan works is a psychological mechanism that seems to go well beyond just a placebo effect. That using a fan gives patients control over their breathlessness, and that then breaks the cycle between anxiety, breathlessness, and more anxiety that tends to drive breathlessness. So there are at least 3 mechanisms by which fans act to reduce breathlessness. This means that fans are really important for all breathless patients, not just those with end-stage disease or with anxiety, but everyone who gets breathless may well benefit from a fan.
I take the fan everywhere I go. I've always got it with me. If I get really bad, then I've got relief. And that's the most important thing to me, is having the relief.
Research suggests that the fan benefits around 80% of people who try it. And importantly, benefit depends not really on the stage of disease, but on how much the breathlessness interferes with everyday life. As of mid-2022, there were 5 published meta-analyses showing that the fan can reduce breathlessness intensity across a whole range of different illnesses.
We conducted a secondary analysis of clinical trial data that showed that the fan can also help improve a patient's physical activity. We now have neuroimaging research and related theories showing that a patient's expectations and mood is important in how they perceive breathlessness. A study we did with magnetoencephalography found differences in brain activity in people with chronic breathlessness who were and were not given cool facial airflow during recovery from exercise. A possible explanation for this finding is that airflow provides a pleasant stimulus, refocusing the person's attention away from the unpleasant stimulus of breathlessness, if you like a neural respiratory gate.
When I first heard about it, I didn't think it would do it. But as realistically, I discovered it does. And I discovered that it's the same as when I was in the car. I used to have the air conditioning spraying on my face to get the air to make it easy for me to breathe. And the fan does exactly the same thing, except it's a lot more closer and personal. I can do it wherever I want, which is, for me, which is great.
Our team analysed qualitative interview data from 3 clinical mixed methods trials, and we found that the fan also improved patients' confidence to go out and about and helped them increase their activities of daily living. But perhaps most surprising was that some patients also reported reducing their use of beta agonist inhalers and home oxygen as a result as well.
I use it probably 10, 12 times a day. Every time I get breathless, I try and use it instead of my ventilator. If I have a really bad attack, I have to use the ventilator and the fan, but normally I can get over it with the fan, which is, for me, which is good.
So the handheld fan is an effective non-pharmacological strategy that has a good chance of benefiting anyone with chronic breathlessness. It can reduce the unpleasant sensation of breathlessness, it can keep people calm, it can increase physical activity, and it can help someone recover more quickly after exercise and give patients that sense of control, which is really important.
If I go out and I know I've got them with me, it makes me feel a lot better because I know I've got relief if I need it. And that's the most important thing.
There is nothing to lose and there is a lot to gain by recommending anyone with breathlessness to use the handheld fan.